Hi there, Dr. Tansavatdi here. So by now you should have received preoperative instructions through an email from our patient care coordinator. This video is meant to give you a general overview of the preoperative instructions to prepare you for surgery. That being said, some of this information is generalized and some of the specifics will be brought up at your preoperative appointment. So some of the things may change, and please defer to your preoperative appointment for the full details. What I'm going to outline today for you is the general preoperative do's and don'ts so that the surgery can be as successful as possible. And that's what we both want. So first, I'd like to go over what medications and what medications you should stop, which medications we're going to have you to start a few days before the surgery. With the medications, our main goal is to make sure that you don't have any excessive bleeding. So some of the medications that can cause excessive bleeding should have been outlined in a separate sheet that you would have received, and that sheet goes over what medications can cause easy bleeding or bruising and what vitamins, because a lot of us take vitamins that are supplements to our medications that we normally take on a day-to-day basis. So in terms of medications, those blood thinners would be aspirin, ibuprofen, which can be found in Advil, naproxen, which can be found in Aleve, and then Excedrin, which is also aspirin. So those medications you'd want to stop. If you're on another blood thinning agent like warfarin, Coumadin, Plaxil, a number of medications that maybe your cardiologist has put you on, those are medications you will need to bring up to us before your preoperative appointment so that I can contact your cardiologist or your primary care doctor to see if we can lower those medications before the surgery or come off them completely. Sometimes your health will not allow us to take you off those medications, and those are important to know. If that is the case, we always want to make sure that I am in contact with your primary care physician in terms of your care before and after surgery. So in terms of vitamins that can cause easy bleeding would be ginger, ginkgo, vitamin E. Your multivitamin will contain some vitamins that can cause you to easily bleed as well. So I'll have you stop those at least 2 weeks before the procedure. If there are other medications or herbs that are not on the list that we've sent you on that separate document, please bring it to our attention at the preoperative visit. Or if your preoperative visit is actually less than 2 weeks before surgery, bring it up to us before then. In addition to all of this, by the time you come in for your preoperative appointment, you should have also received instructions on what labs and medical clearance that we need from your primary doctor before you come to this visit. That being said, some of the times our office has made your appointment, and that appointment might be less than 2 weeks before the surgery. If that's the case, it's important that you get a hold of us ahead of that time and let us know if you've gotten the preoperative preoperative workup. So that preoperative workup, we will send you paperwork, and if you give us the name of your physician, that should have been then sent to your doctor's office so that we can coordinate all the labs and testing that need to be done. In general, those labs and tests include a CBC, a basic metabolic panel, and PT or PTT, and an EKG if you're over the age of 50. All this will be determined by myself and with my team to determine what needs to be checked before your surgery. So in terms of that, please just know that we want all of that clearance done at least 2 weeks before your surgery, and we will make exceptions from time to time, but usually we want that ahead of time so I can review those and be on top of that if in case we need further testing. Okay? Next, we're going to talk about what medications you should continue up until the day of the surgery. So if your surgery is at a facility, a surgical facility, typically we use a specialty surgical center. The other surgical center we may use is Thousand Oaks Surgical Hospital, and we may use another outpatient facility. If you are receiving your surgery under general anesthesia at any of these facilities, you will have you'll get contacted by a nurse either the day before or the week prior. If your surgery's on a Monday, they'll contact you on a Friday to let you know what time to show up for your surgery, but also they will let you know what medications you need to stop and not take the day of surgery. There are some medications in which I will defer to them, but cardiac medications like your blood pressure medication, if you normally take it in the morning, we would probably want you to take that in the morning, but that is going to be deferred to the surgical center and the anesthesiologist per their recommendations. If you need to postpone your surgery, so this is, by now you're going to be watching this video before surgery, but this information is for you to know if you get sick, if you feel like you're getting a fever, if you're getting upset stomach where you're having diarrhea. Those two are important to know. If you're really falling sick, you're having fevers, or you're having diarrhea, that's when you want to let us know ahead of time before surgery in case we need to reschedule your surgery. We don't want you to be sick before or after the surgery, but sometimes if you do have just a cold, that is not an indication where we need to postpone the surgery. So with if you are feeling like you're getting sick, but your temperature is fine, and you're just feeling like you're having cold, that is not an indication that we would stop your surgery. We would still go as planned. But if it's starting to go into your lungs, if you're having some trouble breathing, if you have a high fever, that could be a bacterial infection, and we would postpone in that case. So please let us know ahead of time. Some other things before surgery. So we talked about what to avoid before surgery, at least 2 weeks before. Now we're going to talk about 7 days before surgery. So the timeline is going to move forward. So 1 week before your surgery, you should receive your medication by that point in time, your prescriptions. We want you to fill those prescriptions ahead of time before your surgery so you're prepared. And then what you want to do is also avoid any alcoholic beverages. I know, you probably are going to say, what? I have alcohol, maybe I have a glass of wine every night, and it sounds like it's an overkill. Believe me that alcohol can affect your bleeding after surgery, and we want to minimize that as much as possible. So to have a good outcome from surgery and to minimize bruising, it's important that you minimize your alcohol intake. Now, I understand if you have some party or event to go to before your surgery, that you have 1 day that you want to go ahead and drink some alcohol. That is fine, but know that particularly the first of the last 3 days, the 3 days right before leading up to your surgery, it's important to minimize that as much as possible. So that means no alcohol, no heavy alcohol 3 days before your surgery. And particularly if you're not a big drinker, if you could do it for 1 week, that'd be even more helpful. Then after we emphasized about the alcohol, I want to emphasize about sun exposure. This is crucial for both facelift, rhinoplasty, and eyelid surgery. Anything where you're going to be exposed to some incisions or some trauma to the skin, that you're going to want to avoid any sun exposure before. I want to also emphasize for CO2 laser resurfacing. So if you are getting CO2 laser resurfacing, this is also important. You want to avoid sun exposure to your face, neck, your body in general, because you don't want a sunburn before surgery. If you do have a sunburn, I do have to reschedule the surgery. That means your surgery would be canceled. So this is important to note, and to emphasize again, no sun exposure where you could potentially have a sunburn. So prolonged exposure in the sun 1 week leading up to your surgery you want to avoid. 3 days prior to surgery, so now we're going to speed up a little bit couple more days now. 3 days prior to surgery is when I'm going to have you start Arnica and bromelain. These two items you should have received at your preoperative appointment. If you haven't come to your preoperative appointment yet and you're watching this video before then, know that you're going to be receiving that at your preoperative appointment, so you do not need to go and get this yourself. So first one is bromelain. So bromelain, it decreases the amount of swelling after surgery. It's coming from a pineapple core, the core of pineapple, which helps to decrease the swelling after surgery. Bromelain should be taken on an empty stomach. So how I usually recommend you to take this is you're going to be taking it before breakfast, so right after you wake up in the morning. So for instance, if your surgery is on Monday, 3 days prior would be Friday. You would take that Friday morning and you would start right when you wake up, you'd start taking the bromelain. And it's 2 capsules 3 times a day. So it would be 2 capsules right before breakfast, 2 capsules right before lunch, and 2 capsules right before dinner. And you're going to continue that all the way up until the night before surgery. And then you're going to continue it afterwards, but I'm just giving you the preoperative instructions. The second product is Arnica. Arnica is a naturally occurring vitamin that we use to decrease the amount of bruising. If you have had fillers or Botox injections, you may be aware already of Arnica. But Arnica, the way that we're giving you this, it is a 30 times dose, and so it's a very strong dose. You want to take this at a different time than your bromelain. Typically, there are some medications where they combine Arnica and bromelain, and that's not the best way to do them. They should be separated. But Arnica by itself should be taken under the tongue. It's 3 dissolving tablets in this form. You place it under the tongue, and that can be done at breakfast time or right after breakfast, lunch, and dinner. Again, those 3 times a day. This one's 3 tablets. The bromelain's 2 capsules. And then the morning of surgery, though, you're not going to take these 2 medications. So just avoid these 2 the morning of. This is just up to the night before surgery. The night before surgery, you're also going to be doing 2 things. One is using the Hibiclens Soap, which should be in your packet. If you come to your preoperative appointment, this will be with your supplies. And Hibiclens is a soap that's antibacterial soap. I use it to actually wash my hands during surgery. So it's when we scrub our hands as surgeons, we use a soap that contains this ingredient. So it is an antibacterial soap that will minimize the amount of bacteria on the surface of the skin to also decrease the chance that you get an infection after surgery. So important to use that night of. After you wash your face with this, your skin's going to feel dry. You can put moisturizer the night before, but the day of, so the morning of, you're going to wash it again, and at that point you can't put on moisturizer. Besides the Hibiclens, the night before, you're also going to take the antibiotic, which we would have prescribed. The antibiotic that I usually prescribe is Ceflex. Most people do not have an allergic reaction to that medication, but if you do, if you know that you have an allergic reaction to cephalosporins, where you get a rash, or you get hives, or you get airway issues with this, this is something that you do want to bring up to our attention. Penicillin is related to cephalosporins, but they're not completely the same medication. So there's a cross-reactivity, but it's very low. So that being said, I don't want you to get alarmed if you've taken the penicillin and you have a reaction. But we will take our precautions. If there is concern there, I may change your medication from Ceflex to a different antibiotic. So just know that I usually review your history before your appointment, for your preoperative appointment. So if you get a different prescription that's not Ceflex, it's because I'm taking that into account. Now, the night before surgery, besides the Hibiclens, and the next morning when you get up in the morning, you're going to use that Hibiclens again. So you will receive 2 packets in your bag at your preoperative appointment. So one is for the night before, and the second packet is for the morning of. Wash your face in the morning, and then you're not going to apply a moisturizer on afterwards. I know your skin's going to feel dry. We already know that. but just please don't put anything on, because that will allow me, when I'm doing markings, particularly for rhinoplasty, facelift, eyelid surgery, when I mark, I don't want any oils on the skin, so that the surgical marker can stay, and it will make sure that the surgery really comes out at its best, okay? All right, morning of surgery. The morning of surgery, you will have received also the directions about where you're supposed to be showing up. Either it will be at the Specialty Surgical Center, Thousand Oaks Surgical Hospital, or our office. Sometimes we do use other smaller surgical centers as well, so that may change, but those are the primary locations where I operate. For those locations, again, you will receive instructions the night before or the week prior by the nursing staff. They'll call you with the information. But there are certain medications that I usually have you continue, and that should be deferred. I will defer that to the nursing staff at the surgical center. For most purposes, for most cases though, if you have a blood pressure medication or something that you take for your heart that's important by your cardiologist, has been prescribed by your cardiologist, we do want you to take those medications. There are also some other medications that might not be cardiac related that we want you to take, and those are going to be case by case basis, so those are going to be emphasized at your preoperative appointment. And again, as I want to emphasize, the surgical center will make that final call if you're having your surgery at the surgical center about what medications you're going to take the morning of. This is important at your preoperative appointment. We're going to emphasize this too, but it's important that you do not, you're not alone after surgery. And this is not, I know this is not a preoperative instruction, but this is more post instruction, but it's crucial because you want to plan. So I'm letting you know ahead of time that you are going to need to have somebody with you after surgery, because the effects of general anesthesia is that it can make you just foggy, your brain foggy, and you won't know what medications you're grabbing. So you could grab a medication that is not what we have recommended, and you can get even more sleepy. Let's say you take a pain medication, combine it with something else that we have told you not to take. So those two medications might make you even more sleepy, and you could slow down your breathing, and it can be life-threatening. So we do want you to be monitored by an adult. This is not your teenager. This is not anybody under the age of 18. You want to have an adult with you after surgery. If you've had sedation with us in our office, we also want you to have an adult with you for the first 24 hours after surgery. Again, with the surgical center or with us, we would recommend the same thing. That means also that you should have a driver. If you've received sedation or you've received general anesthesia, you need to arrange for a driver to pick you up and to be with you after surgery. This does not mean Uber, okay? So I've had plenty of questions about this. The surgical center will not let you go home with an Uber driver. They will not allow you to do that. You do need to have an adult who knows you, who can take you home. And if it's not them that's taking care of you for the first 24 hours after, at least another adult that knows you to be taking care of you. All right. So this is hopefully very helpful for you. Please, if you have had a chance to come to our preoperative appointment and you've forgotten some things, this is going to be your basis for preparing you for surgery. So go back and re-review this video if you need to. We are always available for questions. Our office phone number is 805-715-4996. You can also reach out to us at info@facesbydrt.com. At the preoperative appointment, you would have also been given instructions on how to download that Simplast app that allows you to contact us directly through the app. Those questions should be directed to our medical assistant. That can be either Yvonne Chang or Sarah Landers. You also have contact with me, Dr. Kristina Tansavatdi. When you type in that name, you should be able to contact us through the app. Again, please though, reserve those questions for any questions that haven't been answered at your preoperative appointment or through this video. Thank you for tuning in.